Volkswagen.
Scary new medical findings about the effects of vaping and e-cigarettes. The CDC and Surgeon General spoke out this week saying it can uniquely harm the developing adolescent brain, impacting learning, memory, and attention. It also leads to addiction. Bottom line here, e-cigarette aerosol is not a harmless water vapor. A study from earlier this year in pediatrics found smoking e-cigarettes delivers cancer-causing chemicals right into your body. We invited Dr. Michael Lim, cardiologist with SSM Health and SLUCare, to the studio to talk about this emerging science. Thanks so much for being here, Dr. Lim.
You're welcome, Kay.
And really what's so scary about this is that we know some of the health effects, but really the impact of this, especially long term, is unknown, right?
Well, because it's too new, but I think we know enough now to understand that the initial concepts that this is quote-unquote safe is not really going to be true. I think the issue in terms of vaping or aerosolizing the liquid gets harmful chemicals within our lungs, potentially heavy metals, potentially things that are there in the lungs for many, many years, and the safety of which has to be seriously questioned.
Things you would really, if someone said, you know, we're going to expose this to you, you would say no way. And some of these ingredients on the vape liquid, not all the chemicals are listed, right? That's another thing we're finding out. Some of them are listed as flavorings, but we have a list that we can show our viewers. There's actually dangerous chemicals you don't want anywhere near your body in there.
There are dangerous chemicals. The flavorings are an interesting concept because they really are part of the lure to be able to get our young folks to get hooked on these. And then the flavorings work into nicotine, and then the other studies show that this actually leads to cigarette smoking use, and we know about that.
So there's a direct correlation between vaping and eventually becoming a cigarette smoker.
I think there's no question now that that's true, and that's part of the problem with this. It's sort of an entry phenomenon.
So are we talking about the end result being lung cancer for people who vape, or do we really not know what this can do long term?
I don't think we really know about long term, but I think we have to seriously question. So certainly, as we said, it can't be viewed as being safe. We know what the harmful effects of cigarettes are, so if it leads to cigarette smoking, we understand that that's not going to be good. But the heavy metals and the other chemicals that can be, ingested into the lung tissue and sit there for years to come, there's no actual way to get those out of the body. And so they have to actually cause long-term damage for 10 or 20 or 30 years. And it's really going to be studying it for that long to know with definition on what it causes. But I think, again, the fear should be there.
So we're hearing as well, as many as 40% of high school seniors admit to vaping. Would you call it a health crisis?
Well, crisis is a hard word, but I think it's time to really open our eyes. And adolescents don't necessarily always make the best choices, but knowledge is power. And so understanding this is really not the best way to be spending your time in experimenting and new things. And knowledge is power again. So inform ourselves so that we know what's going on, and then we can help our children.
And especially when we really don't know all of the bad things that could be happening. We know enough to be able to say this.
So the lack of knowledge and the lack of knowledge of anything seriously bad is not the same as the converse of it's safe.
Dr. Michael Lim from SLUCare and SSM Health, thanks so much for being here.
You're welcome.